Thank you, Marcia, for your wonderful, inspiring talk. Next, I'd like to have Dr. Al-Qusairi. Am I saying it correctly? Okay. She's going to share some of her experience, so I would love to have you share.
Hi, everyone. My name is Rana Al-Qusairi, and I'm here to share with you some of my experience working in the Red Crescent in Aleppo, Syria, where I used to work. Used to work as a doctor in the field hospital inside the refugee camp of University of Aleppo. So let me tell you the story. The story began in 2011 when the Syrian revolution started against brutal Assad regime. At the beginning, there were just protests here and there, civilian protests, but they were confronted by extreme violence, by gunfire and arresting of people. At the beginning, my city wasn't intensely involved in the armed conflict, so hundreds of other families from other cities more affected by the conflict were coming to my city to seek refuge because it was relatively safer. Then the situation escalated and it became more affected by the armed conflict, and we already have many internally displaced people from other cities. So most of young people whom I know were volunteering in charities and other organizations to help provide humanitarian aid for those internally displaced people. They lived actually anywhere. You can see them in the parks, schools, and dormitories of the University of Aleppo. So I worked in the Red Crescent. They established a clinic inside the refugee camp of University of Aleppo, and I still remember my very first day. That was mid-July 2012. I still was looking around, but two parents came holding their child. He was 10 years old boy. His name was Ahmed, and he was screaming from extreme pain. There was a huge wound on his left thigh. After asking the parents what happened, we realized that their home was bombed, and a big fragment entered his left thigh. They took him to a field hospital in their neighborhood, but unfortunately he was treated by a non-medical person. Because of understanding of those field hospitals, they were training non-medical people for providing medical assistance when they are overwhelmed with injured people. So unfortunately he was treated in bad way, and there was a severe infection in his left thigh and massive tissue destruction that even reached the bone. The doctor looked at me and said, okay, we're going to go ahead and prepare the surgical instrument. He's going to need debridement for his leg. I was confused. Are we really going to do this kind of surgery in simple clinic with simple surgical instrument, with using the daylight? There was no electricity, of course, without even anesthesia, and this was the main problem. But I know that we have no choice but to do the surgery because all other hospitals were overcrowded with injured people, and there is no available operation room for him. We gave him strong painkiller and with local anesthesia, and we've done the surgery. I still can hear his screaming. It was so painful for him and for me also. I spent the rest of my day thinking why all of this is happening. Why should a young boy like Ahmed suffer this kind of pain? Other boys like him should be thinking only of maybe soccer game or next weekend, next vacation, whatever, but not suffer this kind of pain. So many questions in my mind, but no satisfying answer. No satisfying answer actually. So they went on, and I've seen many other cases or patients, innocent people suffering like Ahmed without getting proper medical care. As conflict continues, more lives are lost every day, not only due to the violence, but also due to the failing medical system that can no longer provide people with the basic medical care they need to stay alive. Here I have some statistics from the WHO report. We can see that 60% of about 60% of hospitals were destroyed or went out of service due to extreme shortage of medical equipment and understaffing. There were 25 pharmaceutical factories went out of service, and actually the medication were kind of luxury that day. Only in Syria Red Crescent, where I used to work, there were 40 paramedics. They were killed while they were providing medical assistance for other. Please next. Yeah, so many people are in need for humanitarian assistance because of this ruthless conflict, which creates the largest humanitarian crisis since World War II and has brought massive displacement, death, and destruction. These are some pictures of the hospitals in the eastern side of Aleppo, where these hospitals were targeted by the brutal regime just because they were treating people. Yes. Yeah. Destroyed hospital. This picture shocks me actually. I could not understand how this doctor could manage to continue working and help others in this pile of debris. It's unbelievable. Those are the victims of this conflict. Now we can understand why these people are leaving their houses. It's impossible to plan future in this kind of condition. This was in eastern Aleppo, massive evacuations for 35,000 people that was organized by WHO and Red Crescent. So I know this information are disturbing, but I don't lie. I feel guilty that I left my country when they needed me most, but I'm not superwoman. I mean, I want to make sure that my ailing mother will continue to get her medication or have the available hospital if we need breathing treatment for her. I want to raise my children in safe environment and get them good education. But I think we can do something here. We have our voices. We can advocate for protection of hospitals, doctors, and civilians. We can talk to policymakers, to civil society leaders. I don't know, online campaign or donating, volunteering, but we can do something to help with this tragedy. Yes, this was the team of the medical center that I used to work in. Here I am. This one, and the blood one. This one was the doctor who did the surgery for Ahmed and helped him save his leg from amputation. This is it. Thank you very much for listening. Thank you for inviting me to this event. If you have any questions, please quickly. This is my email, and thank you.